November is National Diabetes Month, a disease that affects some 37 million Americans.
My doctor told me to see an eye doctor, an ophthalmologist or optometrist, to check the health of my eyes.
That's a new public service announcement from the American Diabetes Association, encouraging newly diagnosed patients to really focus on eye health, because studies show diabetes is now the leading cause of new blindness among adults. Let's bring in Dr. Daniel Laroche, an ophthalmologist with the New York Eye and Ear Infirmary at Mount Sinai. Dr. Laroche, appreciate you being here. So talk to us about the link between blindness and diabetes.
Yes, with diabetes, you have elevated blood sugar in your bloodstream, and that can lead damage to the blood vessels. And if you can imagine a picture and you're putting a drop of fluid on a picture and it gets a smudge, that's what happens to the retina when you have bleeding in the blood vessels that occur. And you have mild non-proliferative, proliferative that can occur with increased fluid buildup on the smudging the picture, and that gives you blurred vision. And so we can prevent that with laser treatment and early detection.
If I could hop in, aside from the blurred vision, what are some symptoms that diabetics should look out for?
Well, blurred vision is the most common one. With the elevated blood sugar, the fluid gets into the lens of the eye and it causes changes in prescription of glasses, darkening of the vision. More advanced disease can lead to retinal detachment. You can see floaters, flashing lights, things of that nature. Also, you can develop a glaucoma that can lead to loss of side vision with neovascular glaucoma. Sure. So a variety of symptoms can occur.
Sure. And what role does diet play in preventing this?
Diet is very important. It's very important people eat lots of salads, lots of vegetables, baked chicken, baked fish, drink lots of water, stay away from sugary drinks, cut down on the starch, potatoes, because that increases the blood glucose. Exercise is very important as well. Walking 30 to 60 minutes a day is very important to help burn off that extra sugar. And then meditation and relaxation to reduce stress eating and reduce the amount of stress in your life and stress cortisol buildup.
And lastly, you touched on this briefly, but what surgical options can preserve vision for diabetics who lose their sight?
Well, we have the major treatment is laser treatment. Laser photocoagulation of the retina is the standard of care. We also have new anti-VEGF injections where people can receive injections in the eye to cause the regression of these abnormal blood vessels and reduce the amount of bleeding that occurs inside the eye as well. So those are very important treatments that can help preserve vision.
Glad to hear that there's something that can be done. Dr. Daniel Laroche, appreciate your time tonight.